Yeah, there was a third. I can't remember. Yeah, because Ann is the,
Sure, she'll make her cameo. You might see Ringo though. He's stuck.
Mary's right here. She's snapping, so.
There's Carrie.
Hooray.
Hey, Carrie.
Hello.
Hi,
How
Carrie.
are you?
I am well.
God, it feels
thanks.
like it's
How
been
are
forever
you?
since we've seen anybody.
I know.
7 weeks.
I know it's been a long time.
It has been a while. Sorry, I'm on a new computer, so I'm stumbling around here a little bit. Don't mind me. Because there's lots of names. Look at that. Look at all these people. Golly.
Right?
They
You
keep
go
on
away
coming.
for 7 weeks and suddenly people decide they want to come hang out with you. I love it. Hi, Kevin. Nice to see you.
Hi,
Shen.
Shwen.
Barry, how we doing?
Doing all right, thank you. Hey, Rick, I'm sorry, I said hi, but not.
Yeah, we
Susan.
said
Hi. Is Jerry here? Not yet. Oh, yes, she is.
Yeah.
Hey.
I think Jerry had to step out to pick up her
Okay.
son, so she'll be back.
If I may, Rick, when we get at some point when you see fit, I want to I'd like a point of personal privilege to talk about something I learned about Jerry that I think would be useful for all of us.
Okay.
at your convenience.
Yeah, we could wrap up with that. All right, I think we could go ahead and get started. So welcome everybody to the Board of Health, and we haven't met for a few weeks, 7 weeks to be exact, so we have a packed agenda. And so let me just kind of go through it. We have a public comment section, and we actually have a public comment, which is great. We haven't had any for a few meetings. Doctors on the line, and then Peter's going to talk about staffing changes that have been ongoing. We have we'll move right into some COVID-related issues as far as a whole bunch of things around the activity, what's happening in the schools. Vaccine and mask, I'd like to at least have a conversation about, and also want to talk about the COVID website and collaboration with the public information officer. We'll get a brief update on the Mapc project from the people who've been interviewed. We have an update on the health director position recruitment, on incident command. A lot happening at the Reading Coalition. We'll hear from Kevin. And then our usual monthly report, approval of the minutes. And Carrie, I think, will probably chime you in there on some comments, and I have some comments as well. So why don't we start with our public comment section, and I'd like to welcome Nancy Doctor, who's been on the board in the past, and as I know, talked with Peter about her coming here. And so Nancy, why don't you just go ahead.
Hi, thank you very much. Nancy Doctor, Pearl Street, and I'm a Precinct 1 town meeting member. And part of why I'm here is in preparation for the October 18th town meeting. Article 5, is going to be addressing the building requirements for public health and public safety's merging. And I guess I had wanted to address a couple of issues here tonight because I'm looking for some real guidance and answers on the 18th of October for town meeting regarding the restructure. I actually think in some ways this could be really positive because if you think about it, the police already have a public health kind of agenda or goals. They're supposed to reduce morbidity and mortality, focus on road safety, emergency response. So in some ways they have a primer for public health. But I have some questions that I'd like you all to consider because I'd like some input from the health department and from the Board of Health. The physical building itself, I guess I'm looking for some guidance on access. How are residents to access the health department? Because I have a lot of concerns about residents coming in and having the police dispatch be the first thing they see when they're trying to access the health department. So I'm wondering where's the access going to be for the health department? And then what's going to be the name of the new building? I myself like the idea of public health and safety building, but I don't know. It's a really interesting idea of how you're going to merge these two departments. My thought is that to collaborate, you're going to have to really introduce a lot of public health terminology into policing in order to really establish some type of common language for goal setting, for measuring results. And I don't know how the health department and Board of Health, how you plan on addressing this. I don't know what type of training or input you're going to have. I don't know how you're going to address data sharing, what type of policies you're going to be supporting. I wonder why we're not having a public forum to address what the residents want in terms of this merger, because we have public forums on green space and on recreation and everything else. And this is actually a really important thing that I don't think most people understand how important this is. This isn't just about the pandemic and having you be in physical proximity to each other, because that's really kind of small potatoes. This is a really big picture issue. And I think if we can address some of these issues going in, it could work really well. But if it's just about proximity for emergency response, I think we're missing a great opportunity. So I guess I'm hoping that you would have some discussion among yourselves to come to town meeting with some idea of how do you see this proceeding? Because I don't even know how you're going to measure the results of this merger, because how we measure public health results is not the same way police measure perhaps their results. We're not going to be counting the number of tickets issued or the number of calls answered. So I have a lot of questions, and I am really hoping between all of you and obviously the police chief, some of this would be answered going forward. That's my public comment.
So why don't we open it up to comments? Kevin, I saw your hand and then we'll go to Terry.
Hey Nancy, it's Kevin. This was actually, my understanding was this was more of a facility move. This is not a merger of the police and health departments. That this is a move that we need private space for our health department staff that is not sitting in a cubicle discussing public health matters. Someone needs to clue me in on it as well too, Nancy.
Well, you
Same.
can't put a health department in a police station unless you're going to actually change that concept. If that's exactly what it is, you're going to have two departments, and you're going to have to change the name of the building, and you're going to have access for the health department. I mean, I'm just saying, it's not friendly for an individual to come in and access the health department. I mean, look, this has been an issue that came up when Ricasa was in the police department. These are not new issues about making it friendlier for individuals. Look, we have very nice policemen, but it's still walking into a police station. So yeah, I think we have to talk about, if you're going to put a whole department, a department that our town manager is saying this is this is a big innovative step. And I think, Bob may have a bigger vision, then you all need to address that. I didn't get the sense when Bob presented this that this is just a space issue. He saw this as very innovative and cutting edge, is what I think he presented to us.
Terry, do you want to comment?
Yeah, if I could, thank you for being here, Nancy. And I want to echo what Kevin said first, that it is not my understanding at all that we are merging with the police department. And if that's the case, then we've got some more work to be doing and discussing.
You're not merging
So,
with them, but
if I may,
you're going to be under the same umbrella.
if I may. So we're moved into, on the organizational chart, there are 9 department heads, and there are, I think it's a half dozen buckets of that people are grouped into. And there's economic development, there's the community services piece, and the piece that we're moving into is we're moving out of the community services, public services. We're moving out of that into a bucket that has been called public safety, because that's where police and fire sit, and they are public safety. So they're in the same place. Police and fire have definitely not merged. And we're just joining their grouping. I'm in favor of that move. I think that it is innovative. I think that it is very interesting. Public health needs to be a partner with public safety, particularly with fire. But that's the work. We're engaged in community prevention. We're engaged in some degree of enforcement. Everything's to different degrees. So there's a lot that goes well with that. We have a relationship with the community that's different than the folks in public services. And I think that shifting that way is a positive. Now, again, if we're moving, if we really are merging, then I need to get
Recording
caught up,
in
and
progress.
Shame on me for having missed that. I wanna go back though, Nancy, the point that you raised about the access, I think that that's an important point in consideration as we think about building out the space. We know that we're reviewing a job description for the social worker that was identified on the floor town meeting in the spring, and that position is, I think, tentatively would be housed in there. That it's talking about substance use, the social worker and public health together. So I think that that's a really important point to think about. What do we do that allows access to folks with a modicum of privacy? And I'm glad that you raised it. I hadn't thought about that, and I appreciate you highlighting it. So that's that.
Right, I would
yeah.
sort of second all of Carrie's comments and Kevin. And then Paula would triple them. And, you know, I would say a couple things. One is, I think it's, although Jean has done a wonderful job supporting the board and the health department, and, you know, but in 5 or 10 years, she'll be sunning herself in Arizona. And I think it was a win to have the health director report directly to the town manager. It gives health a seat at the table with those 8 other department chiefs that Carrie was alluding to. So from my perspective, that was a big win. I think the other of these departments, you know, the police chief is reporting to the town manager, as is the fire chief, as is the health director, separate lines. They happen to be budgeted. I don't really understand the budget component, but they cluster them together. But these are separate departments. I think what we saw as the big advantage of this move, and I would agree as part of the build out, we should have a sort of some kind of way that people can access help without going through the police. But I think one of the thinkings behind this was that the work that happened in incident command and, you know, Carrie and previous board chairs and so forth on that really showed that, you know, with public safety working with health and the schools, there was an opportunity to do better work together. So
Absolutely.
part of this is cohabitating health coalition with the new counselor position, and, you know, public safety. And the idea is that bringing these groups in physical proximity will foster better collaboration than having one at town hall and one somewhere else. And so that was the notion. It's really kind of extending some of the wins we had with incident command to say, hey, working together, these groups probably can do a better job. You know, I came from a role in a large organization, and a lot of times people hyper focus on org charts, but really what's important is the groups on the ground working together and how well they work together. Where they kind of sit physically or on org charts isn't always the most important thing. So that was kind of at least my thinking of this whole process. Any other comments from the board? Jean?
Thank you. I have not seen the plans for the space, but I have been in meetings where there's been discussion about it. And it's my understanding from being in those meetings that the idea is to reuse the community room for this office space. So it would not be offices that you would need to access by going through dispatch or going through some sort of locked off area of the building. The community room you can access right from the entrance, from the vestibule, and go right into an area, just like if you were to come to town hall. So I
The
think that,
problem with that, Jean, is that when someone walks in, that's the first thing they see is the dispatch. So that's a concern I would have, and I'm going to raise that actually in town meeting. I'm also going to raise the issue, you need to change the name of the building. If you're going to house all these, entities, it should not be called the police department. It should be called something along the lines of public health, public safety, whatever you want to do together. But you can't have all of these different entities and then just say it's the police department, because that is in fact what you're saying. It's not just the police department. It's all these different departments, and that should be reflected. And I do not think it's at all user friendly to have an individual walk in. When you walk into that vestibule, the first thing you see is the dispatch window. We all know, where the community room is. You need to have some type of separate entity entrance or somehow reconfiguring that lobby, because that's actually one way to drive down people's use of the health department.
Carlo, you had your hand up. Oh, Anne's going to put up go ahead. Anne, why don't you do that? So this is the org
Did I
chart.
successfully do that?
Yep.
Okay.
Do you
good.
want to comment on it or?
No, just happy to share it in case it's helpful for folks.
Okay.
Thanks. So, Richard, you and Kerry hit the nail on the head for the framing of this. And yes, it's under that roof. But just as an FYI, I don't know if Nancy was at that meeting or listening or watching our meeting. Chief Clark asked for funds to do work to the building, and wanted to push that out further. They weren't satisfied with the money being spent, and to enhance and reconfigure that community room in other parts of the building. So Ann can correct me, but that did come to the board.
I know that there was concern about whether there had been sufficient community vetting.
And sorry to stop you real quick. I know that there's 3 in the room tonight. Before you start discussing amongst yourselves, you should probably call yourselves to order.
Oh, yeah, good point.
Okay.
Thank you, Kevin.
Thanks,
Sorry.
Kevin.
Kevin, you're awesome.
Well, then as vice
You are
chair of the
awesome.
select board, I'll call the select board to order. So I think that, not to speak on behalf of colleagues who are not present, I think there were some concerns expressed as to whether there had been sufficient community input, particularly around what priorities there are in the community in terms of capital investments. But ultimately, the board chose to have the warrant close with that item on the warrant. And I think myself and 2 other members of the board abstained from whether to endorse that particular article or not. So sort of keeping it open, and there were abstentions on other articles as well. I think there was a feeling of there needing to be additional community input. But all of the articles did make their way onto the warrant for consideration by town meeting in October and November.
Thank you, Anne.
Could I just chime in here because what I think Nancy is saying has something to do with branding.
Mhm.
And I think it's kind of radical that we would consider changing the name of the police station. But I think she's got a really strong point. When people want health services, why are they going to the police station for them? And is there a separate entrance? And I'll get a little goofy right now, but they started ladies' lines in Brooks Brothers when I was a big fan of that store. I could afford it. And I thought they ought to change the second floor into Brooks Sisters. Come on, the Brooks Brothers for the guys. And so people do get accustomed to certain things, and names carry a great deal of, I guess they carry a great deal of influence. And so I think you're onto something. I'm not sure how popular it's going to go, and it's easy for me to sit here from a remote position and just mouth off, but she's asking for some help here. And I think at the very least, we should offer encouragement from other groups, the ones that put in 2 cents worth on ballparks and open space. Come on. This deserves at least that much. That's all I got for now.
I would say it's the identity. It's an
Yeah.
identity, and we need an identity.
Yeah. No, I think the access issue and maybe even labeling the building, is something that should be sort of further vetted and looked into. I think you all make very good points on that. I would agree.
Agree.
Is it appropriate, Mr. Chairman, to set up the next or the very first public comment meeting where we can carry this a step further? At least Nancy can go to town meeting next week saying the discussion occurred, it was progressive, and regardless of what happens tonight on town meeting, there are plans for maybe just to request Bob to, or whoever it is, to set up a advisory board just to begin the discussions on this.
About how this would work and also these other issues around access and identity.
Doesn't sound like anybody's thought about it. Somebody should be thinking about it.
Yeah, agreed. Thank you, Nancy, for all of this.
Thank you for your
Thank you.
time.
Thank you
Thank
for
you
your
very much.
feedback.
Thanks.
I think we should, I don't know what board members think. I mean, I'm happy to, speak to Bob, with Jean and Peter about how we could further vet public opinion around the issues that Nancy raised. The more authorize the funds, it really doesn't speak to, how this is all going to come together. Right. So I don't think we need a vote on this, but we'll commit to going back to Bob. And if people have ideas, if any of the board members have ideas about what type of process or forum would be best to do this, please, give that feedback offline. Okay. So I think we're going to move on from public comment if there aren't any other discussions, and Peter has some updates in terms of staffing.
Chris
Well,
has his hand.
There's one public comment over here.
Okay.
Did I miss something?
Yeah, Chris has a comment.
Oh, okay. Go ahead, Chris. I'm sorry. Too many boxes to look at,
Too many. Thank you. No, I didn't plan on making a comment, but I think to Nancy's point, I didn't think of renaming the police station or anything until now, but perhaps a good compromise is just like the Reading Police Department and public health or something. You just add the extra line underneath it. Just seems like you're not renaming now the whole thing. You're just adding an extra and public health to the bottom of it. Just seems fairly easy kind of a fix. If people agree to that, not that I believe one way or another, but just seems like the easiest approach for that. But thank you.
Thank you.
That's a good idea as well. All right, Peter, staffing changes.
Well, I think everybody by now knows when I arrived here just about a year ago, we were working with a skeleton crew. Christine was here on a part-time basis. We had an opening for a nurse who didn't exist. And we had an agent and an inspector. And pretty soon Schwang's position got filled, and that was a glorious day when that occurred. And we had a full-time nurse that was, young and motivated to do the job. And she's been doing a great job too, by the way, as far as I'm concerned, she has been. Slowly but surely, after I got here, maybe it was something I said, I'm just kidding. But people resigned, and the most recent resignation occurred, and it's kind of hurtful. I'll get emotional because just the way I am. But I helped Daniel for the last 4 months, encouraging him, making sure that he was meeting deadlines, paying from the health's budget to get certified as an environmental health specialist. And and so forth. And then, last Friday, lo and behold, his grade came in, but more importantly was the piece of paperwork he needed signed off by his supervisor that he met the qualifications, and I was happy to sign that off. And he resigned. And he resigned in a way that was kind of hurtful to me. He didn't resign. He didn't discuss it with me. He didn't have to, but geez, it would have been nice. I've been working hard, honestly, to try to build a rapport with this man and see how it goes. So the long and the short of it is, once the drama is behind us, we don't have a full-time inspector right now. We're working with one contracted inspector that was approved back in March of this year. And this came after we lost a previous agent, and we needed someone out on the field. Well, the occasion arises again that we need somebody. And some of the conversation that I had with folks leading up to this was, if we just hire people that do inspections on a fee-for-service basis, they bring back problems that no one's there to help address. And that gets us into a deeper pickle than before. So I had to step up a little bit and find an experienced inspector who does do moonlighting and consulting. I guess moonlighting is not a good word, but consulting is. It means the same to me, but he would be happy to begin participating as one of our contracted inspectors. And my proposal for the board's approval is to expand this contracted services arrangement that we have and begin working with another individual who can help us get there. And I would let you toss whatever you want back at me, like, why did this happen, or what caused you to think that way? I don't care.
The current part-time person inspector we have is like 8 hours a week, or something along those lines. It's a very, very part-time role that this person's playing. And I think what Peter is referring to is someone who would be closer to, I don't know if he would be full-time, but he would have he would not only be experienced and be able to problem solve the issues that arise on inspections, but would actually have more of a presence in the department. Am I right on that, Peter?
Well, we'd like to start slowly with this. Dennis Palazzo, he's been with us for a few months now. He works off of a list. So he can jam as many inspections as he would like in. So it's not an hour per day. It's a fee for service. In my experience, that works the best. With the fellow that I have in mind right now, though, he's capable of, what's the next step? In most arrangements, a contracted inspector goes out, does the mandated inspector, and comes back with violations or a clean bill of health. And if there are violations, we have had internal people go up and do the follow-ups. Do we need a reinspection? Do we need a notice of non-compliance? Do we need an order to correct? Do we start levying fines? Do we bring them to the Board of Health and discuss the structure or the status of their permit? That's not in place right now, but the person I have would be able to carry this up the steps. Dennis does not have that level of experience. He does this inspections. He knows the codes and can apply them. This next person would have to spend a little more hours, but I hate to think, Rick, that we would be getting, I'm looking at Gene for body language about, we don't put him on a salary. It's on a fee for service basis. Is there a sliding scale? If he's just doing a routine inspection, he gets X. If he's doing compliance work, he gets X times 1.2. Whatever it is, we can work that out, certainly. But it's not a buyer's market. We're the buyer. It's a seller's market. Those people are needed all over the Commonwealth. And I work hard keeping my connections and seeing if we can't get somebody to come and help us out, especially when we need it. And I see you, Paula, but can I offer just one more thing? And some people are going to groan when they hear this, but this is the extent of where we stand. Yesterday and the day before, we had a water main break in a part of town where there were plenty of restaurants, a healthcare facility, a supermarket, and we had no water going to these places, and we had nobody in the field that I could I could send out to, let's get this in order. Let's make visits, make sure they're not, making coffee with whatever. There's a bunch of things. And there are some very important protocols in place. You can operate with no water if you have a way to heat it and wash your hands. You're going to get it from an approved source of this water. It's not coming through the pipes anymore. We didn't have anybody to do that. The relationship that we built with the fire department, everybody in this little chat room of ours right now, worked very closely with the fire department throughout the last year, together very closely with vaccinating and making decisions. Those guys rose to the occasion yet again. And after some quick training on the fly, Jackson, Deputy Chief Jackson, was out there doing what health people should do, and he does a good job of it. Come on, he knows how to speak to people, and it's not that difficult if you can reach the folks and let them know the logic behind it. Now, I bring that up because I don't know what tomorrow holds, but the point is we don't have staff, and we need some staff in place.
So, Paula,
My question was, is this person coming in permanently or just to fill in until we get someone permanent?
I don't like to call them employees. They're contractors, and they serve at the pleasure of, in this case, the director of health. So I would say, yeah, when we don't need them anymore, and we have her, and we have permanent people in there, then it was like, thanks a lot for your services. And this guy I have in mind, he moves around anyway. Right now, Topsfield Fair is going, and they need inspectors down there. So guess what? He's putting in 40 or 50 hours a week. He's going to move someplace else. There's plenty of work.
So my second question is developing relationships with the businesses that they're inspecting. If you have, I think that's kind of an important piece of it.
It's very important. Our permitted entities or establishments, they deserve to be treated properly. And of course, everything begins with developing relationships. But the people we have right now, I have full confidence in, and we can go back to getting any feedback we want on Dennis Palazzo. He's got the idea about it, and it's not a, we kind of joke around, and after a while you think, what the heck is this guy made of? But we don't incarcerate, we educate. And this is what I've taught these guys from the beginning. You go in as an educative source, and if it doesn't work, we try again. After 3 times, now we might have to stop moving it along. So we will be developing relationships, and that only comes with time, Paula. No matter who we get, it's going to take.
But if you have somebody different every time.
No.
But I think also, just to be clear, this person that Pete is thinking about is a contracted temporary inspector, and we are going to fill the permanent position that Dan is vacating. And I think that's, Paula, when hopefully if we have some, length of time of service, they would develop those relationships. This is really just a stopgap measure. The permanent position isn't going away.
Got it.
Yeah, Carrie and then Kevin. Yeah.
I had one question and one observation. Communities, many communities in the state entered into public health mutual aid agreements in part to address circumstances like this, or circumstances when, like when you were in Danvers, Peter, and there were, larger issues that you had to cope with there with the explosion and the like. I don't know if Reading is part of a mutual aid agreement for public health, that they might be able to access support from another community. But that would be great, because if that's the case, then it might be another way to access some trained folks and back up. So that's my question. My observation is that this seems like another incentive for us to be looking at the public health excellence grants the next time they come around, and seeing if we can find an opportunity for a shared services relationship, because it's very challenging to try and maintain staff. And I see Jean smiling. She worked really hard on that grant application. but it's definitely, that's something, those are further down the road, but,
Quick response to your question about capacity and sharing with mutual aid. I mean, there is one individual who's reached out from North Reading and has asked, if you need any help, try to see what I can do to help out. And that's fine.
Okay.
Most folks are so stretched out because of what's occurring out there that the capacity for their services exceeds, the personnel that deliver them. So,
Yep.
yeah, I hear you, and it's not feasible
Just-
at this time.
Okay.
Totally.
That's fine.
Thanks.
That's fine.
Can I offer one more thing? I know Kevin's saying something, but back to Paula's point for a second. I was a federal inspector for a long time, and every 4 months or so, they would shift you from a different food processing plant to another one, so you wouldn't develop relationships. They didn't want you getting too friendly with management. They just wanted you to focus on the code and observe the practices and record your observations. And this is not uncommon. The city of Boston does the same thing. If you stay in the same area for too long, you get too friendly with the people, and so they shift them every once in a while. So it's a good idea in a small town. I think it's a great idea, but there is logic to let's keep everyone on their toes and until we do get some stability. Yeah.
Thank you.
Kevin?
Yeah, I just had a question. I think this is probably for Eugene. I remember when we hired Daniel, and it's sad to hear that he's going to be leaving us. But I don't think we had too many folks throwing in job applications back then. Correct me, right? Do you remember at the
I
time?
remember. That's correct.
Yeah, so that was pre-COVID. Around. So, Peter, this person we can contract out. I think it's great in the interim. Obviously, we need something in the immediacy coming up. So that's great that we have somebody. I want to make sure that we continue as a department to create those new relationships, always looking for new folks to contract out rather than lean on one person. If we can get 2 or 3 folks that we can lean on for contracting, I'd prefer that method until we find someone, because it could be a while.
Yeah, I don't disagree with that. Thanks, Kevin.
Yeah, I just want to make a comment in response to Carrie's question about, do we do mutual aid? I don't think we do mutual aid in public health, but we do some things that probably are close because we're, the world of municipal government, everybody knows everybody. And on many occasions in different parts of the organization, we have leaned on our colleagues in other communities. But specifically in public health, we have a regional shared services agreement through the police department for animal control.
Mm-hmm.
And so we are doing that regionally with a guy that used to be a colleague of mine when I worked in the town of Saugus. So it's a small world for sure. He and his wife are filling that role. And we also, I believe, work with our colleague in Wilmington when we need a septic abandonment.
Correct.
So that relationship exists. And we also have Maureen Busby from the coalition in Melrose that we use for our tobacco inspections and for tobacco compliance. So I think there's a little bit of that going on. To your point, it could be a whole lot more. And to the, excellence grant and all of that what we worked so hard on to get on paper and then get funded, only to find out our partners didn't have the same enthusiasm that we did. But that's clearly the future, no question.
Jerry, did you have your hand up? I'm sorry. No. Carrie?
Sorry, Jean, you just reminded me of something. So yes, through the, so I did a lot of work on public health mutual aid and then on the state law that did the, that went into place to effect. So there's a opt-out agreement that is a public safety and a whole lot of other things that if the communities are part of, then you can access. So the mechanism is in place that makes it easier. So if there was a town that had what we needed that we could agree on, there might be a way to access that. Thank you for reminding me about that, Jean. Yeah, that agreement was a lot of work, but a useful tool for a lot of municipal services.
I don't think we need any type of voter resolution. Actually, we look back and in the March 18th minutes, the board did authorize Peter to hire contract services as needed. And so this is just part of that process. And hopefully things will work out on that. I think we can move on unless there are any other comments to the COVID-related issues. And Christine, I think you're there.
Yes, I am. Hi, good evening.
Do you want to talk to us about where we are with the COVID activity and, your collaboration with the schools on COVID?
Sure. Yep, of course. So for the town of Reading, the case count that I've provided with regards to COVID data is via Maven reporting, and it is a report that was run over the past 14 days. The total case count is 2,228. Total active is 45. Deaths remain at 50. Transferred cases remain at 10. And number recovered is 2,123. At the present time, and I would say about 58% are breakthrough cases. The main method of transmission remains to be household. And with regards to school, the data that has been provided was after discussion with Mary Juliana, the head school nurse, and the cases are as followed. There are 42 school cases currently. No known in-school transmission. Household does remain the main source. To break it down, high school, 7 cases. They were not vaccinated. The middle school, 2 cases, not vaccinated. Elementary school, 29 cases, and pre-K, 2. I was informed that the vaccination rates for students are 83%, which is great, and 84% for staff. Excuse me. A COVID clinic was held a little bit over a week ago through the school via PelMed, and 29 students that were vaccinated at that time. There is a COVID vaccine clinic on November 5th for 3rd dose for qualifying staff. And I do know that the school testing, they are conducting the test and stay. Nurses are working really hard to conduct these tests, and they have done over 500 tests for 164 students, and they are conducting trial pool testing for high-risk staff. Excuse me. And with regards to COVID clusters, right now there are not any. There is a potential at the Christian Co-op preschool, which I was informed of by one of the epidemiologists at the state. However, there's just only one known positive case, and the classroom, there are 2 classrooms that are in quarantine. I do have a roster and have contact traced both classrooms, and excuse me, they are scheduled for testing at the appropriate time interval. Thank you.
Any questions for Christine?
Can I just comment before we leave this? If there are questions first, go for it. This is the surveillance that occurs every day, many hours during the week, 7 days a week. Christine works on Sundays to keep track of these things. Sometimes it seems dry. Doesn't seem dry to me. I know Schwung thinks it's pretty good too, because we're looking for clusters in kids. What could be more important than that? But Christine does a great job. I want to thank her for that. Part B, I want to bring this up because since we met the last time and it was kind of getting batted around a little bit, and I think it was just me. People were asking questions that I was losing patience with about how are we going to post the raw data that we just heard on the website, and it got pretty, testy a little bit. I don't even know if testy is a good word, but it was redundancy built in, and it's we made a decision at the board meeting. The board's going to meet at this time, next time they meet, and we'll discuss it then, okay? And that's just my style. One of those persons turned out to be Carrie, and I handled her the same way I handled other people. Now today, thank God, we had a good conversation and aired out like, what did I do this time, Carrie? I know I'm a blabbermouth and so forth, but help me here. I want to make up. And I missed it. All she wanted, for her own reasons and to be able to study it, the number of cases. As a Board of Health member, I would say to the board right now that yes, the Board of Health member does have data whenever they want. Christine's listening. And I would prefer that the board comes through the director to Christine and Christine through the director back to the board, so we're not getting mumbo jumbo all over the place. But it turned out that Kerry had a very reasonable request. I misinterpreted it, and it be discouraged if the next time you think you might want to see cases. I'm not going to bite your head off.
Well, maybe, since Christine does do this on a regular basis or weekly basis, maybe she could just blind CC the board. I mean, there's no harm in that. And it doesn't require any extra work. And it would be good for the board to be, updated.
Sure.
I would love that. If
Good.
that's
Especially
possible.
going into the colder
Thank you.
months.
Yeah.
Yep.
Okay.
Rick, I just got a question,
Sure.
Christine, if I may. Hey, it's Kevin. Christine, how you doing?
I'm good, thank you.
So I'm just looking at these, at the data that you just gave us right now. You're saying it's mainly household transmissions, and we have 45 active cases in town, correct?
Yes,
Of which 40 of those are in the school. So I'm assuming that's staff and kids.
yep, believe it or not. 9 other cases came in through the queue as well. So I didn't add that on to the total. It was after 5 p.m. this evening.
So an additional 9 that we don't know where those are right now.
That's right.
Okay, so we don't know if that's school or whatnot. Okay. Wow, that's that seems to be a big number if it's mainly through households, and we have 45 active and 40 in the schools.
Yes.
So is
Yep.
it like, I guess it's a lot of siblings?
So what, yes, it is a lot of siblings. And what happens sometimes is the schools are often picking up because they're doing the testing before these cases are hitting the system. So in other words, Mary and I will be in talks several times a week, and how we communicate is if something comes through Maven, I will forward her a case number. However, if she picks up a case before it hits the system, she'll give me a call, just because it is HIPAA and private, and we don't want to send emails with people's information. So she'll actually give me a call. So I will keep a list of that, and I'll keep an eye out in the system, because again, many times she does pick them up before they will even, the electronic lab reporting will get to me.
Okay.
So I know it does seem like, the numbers are a little off, and that is true. I think I try to match them up as best as I can. Sometimes she'll have 8 cases, and I won't know about it until 2 or 3 days later. But at least they've been identified and they've been provided with guidance, and that's been really great. What we have worked out is if she is able to identify someone through the testing at school, she provides the guidance, and then I will follow up and just check in with that family or that individual. And if I happen to be on a weekend and pick up the case before she knows about it, I will provide the guidance and then also follow up with a clearance letter once they've completed their isolation period.
Okay.
The
And then
school nurses are
the,
great. They're doing a lot of work up there.
yeah, I'm sure. Yeah, they've been doing a lot of work for a long time. They must be exhausted.
Yep.
Unbelievable. But and then you said the 7 and 2, the high school and middle school, were not vaccinated. Did I hear that correctly?
Yes, yes. So
Okay.
we're just trying to keep tabs on how many cases were vaccinated and how, the percentage of vaccination.
Do we know that at the elementary level or no?
So I think because I think the majority of them are under 12, like they are not able to receive vaccination as yet. Okay.
All right. No, I'm just curious to see if we're getting breakthrough cases at that level, or if it's more just the the 20 plus age bracket.
Yeah, I would say the breakthrough cases, the symptoms are much milder than initially when COVID first came out.
That's great. Good.
And I am trying to keep track of, I don't know if it really matters, but who received which vaccine, whether it be Moderna, Pfizer, or it's pretty even.
Yeah, they all work great. Don't go digging too far on that one.
Yeah, no, I like the foresight though. Sorry to just hop in here, but I like the foresight because that may become useful as we learn more as time goes on. So that's great.
Definitely.
And can I also just make one more comment? I am keeping track of reinfection. And there's been a couple of residents as well, cases that have received, believe it or not, the booster already and still developed. I mean, I know that that's still a possibility. So I'm just sort of keeping track of that data as well.
Oh, that's interesting. So they had it, went all the way through the booster and got it again. Okay.
Yes.
Yeah, Anne has had her hand up for a bit.
Thanks, Dr. Lopez. I just wanted to offer some thoughts about the publishing of the data from someone who was in receipt of daily numbers at one point in time as a Board of Health liaison, and then followed the weekly numbers, and now do not have access to any of the numbers. I remember at one point in time when I think I was still in possession of daily numbers, as a Board of Health liaison, hearing from a member of the public frustration because, as it turned out, I think there was some kind of backlog with Maven and the numbers were maybe 10 days out of date, something along those lines, and they didn't reflect accurate data. And hearing from a member of the public who I think may have emailed the full select board to say, these numbers I rely on to make decisions regarding my own personal behavior as well as that of my family. And that certainly is true for me, and particularly being a parent of kids too young to be vaccinated. And it probably not having access to the data makes me more conservative in my behavior, not knowing what the numbers are. And I did try, and it may be lack of familiarity, but trying to find the numbers on the state's website, and I was unable to do so. I did find percent positive rates. I did find that, but I didn't find the raw numbers. And knowing I had been tracking them over time and then not knowing what those are now is kind of hard to compare. So I don't know if there may be some kind of way to provide some information on the website that's not so onerous, maybe not every day, certainly not every day, I don't know if, every week and a half, if there's a way to provide some information on a regular basis, but maybe not so frequently that it's such an administrative burden.
Oh, no. So I can tell you that I run a weekly report, and I do forward that. I'm happy to share it, provided that, that is something that, the board and my managers approve of.
Right, so we had decided back in, I don't know, May or June, I think when things were really quieting down, that we really did need these weekly numbers.
Right, well, it was around that time that I started, it was around June, and I was, doing everything, so that the number was 1.
Right.
Things have changed, unfortunately.
And so we went to once a month, and I don't actually, because Christine actually does the work to produce the numbers every Wednesday or Thursday. Distributing it to the board members, as we talked about earlier, is just a CCing on an email. So I think that's fine. And we did say when we decided that we would increase the frequency of posting the numbers on the website, if things picked up in terms of the pandemic, and maybe we should go to every other week. It's a little bit more work for the folks working on the website, Shuang and so forth, but it's not that much, and it would only be, because now sometimes it's actually gone over a month, which I think is a problem. So maybe we could go to twice a month. Carrie, you have your hand up.
Yeah, I would strongly support that. That was one of the reasons that I had asked Peter about getting access to the weekly data. I wanted to see what was happening, and my thinking is that providing the information is a source of information and comfort to folks. I know there are a lot of people who are still extremely anxious about this. And I think that if they could see numbers and see caseloads and say, oh, well, it's not as awful as it is in Idaho. I think that that's useful. I don't think that, so that was kind of what I was starting, why I wanted to kind of see the numbers. And that was what I was starting to toss around in my head, was that there's use in communication of the information. And maybe we ought not to think about it just in terms of if the, if the volume starts to rise, then it's important. But again, as you said, Rick, I know, it's extra work for staff, but I would be very much interested in increasing that if we can.
I think also, given the the point that Kevin made, or the data showing that, we have 7 or 9 adult cases and 40 or odd school cases, we might want to, if we post it, just break that out. If there's, 45 cases, 40 are school related, whatever, and 5 are, because 5 cases in the adult community is pretty, low. It really tells a story about activity.
Yeah, agreed.
Okay, so I think we should go to every other week and maybe break it up like that. I think that would meet people's needs. I wanted to talk a little bit about masks and vaccines, because this has come up. I've had a couple conversations with residents. It's come up with the board, and we did have a discussion about this at our last meeting 7 weeks ago. But I just wanted to coalesce some thoughts and have another discussion about it to see if we're in any different place. And go ahead, Paula.
Just wanted to thank Shuang for posting the statistics. I thought that was extremely helpful.
Yes.
As we go into this discussion. Thank you.
No problem. Thank you.
I wanted to, I put some things down, and I've never shared a screen, but I'm going to try to do that and see if it works. Oh, that works. Okay, good. So let me run through. I think the board members saw these slides. If may not have had a chance to review them. I don't think the select board members have seen them. So I want to talk about two issues. One is around a mask mandate, and then we'll get to vaccines in a moment. So going through this quickly, there's only 5 or 6 slides. Currently, we don't have a mask mandate in Reading, except for the library, which implemented one September 20th. About 100 Massachusetts cities and towns do have a mask mandate for municipal facilities, and it includes all the towns in our emergency preparedness region 3B, except for Reading. Wakefield does. Woburn and Stoneham, I couldn't see that they have a mandate. So it is fairly widespread to have it in municipal buildings. As of August 30th, which is the last thing I could find, 45 cities and towns mandated masks in all public indoor spaces. So that's much less of a common thing. Here in Reading, town hall employees routinely wear masks, even though there's no mandate. And actually, a recent survey that was done in the last 48 hours showed about 91% of those employees are vaccinated. And as you know, most interactions in the town hall are brief. There's a lot of plexiglass barriers protecting people, staff, and visitors, and social distancing is encouraged. We, at the select board meetings, and maybe others, although I've only heard feedback from the select board, many of the public attendees are not masked. And although the seating is range spaced, there's space between the public and the board. Present. So this has raised a little bit of concern about having sitting for 3 hours in a room with a lot of unmasked individuals. And so, you know, I did go and looked at the data for Reading that appears on the state website. And it does seem that our summer surge is sort of declining. And this is where it is and very tricky to navigate this spreadsheet. But basically what it reports is the average daily incident rate per 100,000 population for every town. And in early September, we were running at 17.5. It bumped up, and then it has started to come down. And actually the number from today, because they update it every Thursday, is 15.7 in Reading. So it is continuing to come down. Similarly, the percent of tests that are positive, which is another indicator of activity in the community, has been declining. And today it was down to 2.38. So one, as we think about what to do about, or if anything, about masks, you know, one piece of information is that it seems like, at least for now, we're on the downside of this surge. Doesn't mean we can't have another surge later on, and the facts will be different. But this is where we are today. And then the CDC recommendations using these same types of numbers is, you know, low transmission is less than 10 per 100,000 incidents, and percent test positive less than 5. And the CDC would not recommend masks in public indoor spaces. But for all the other degrees, they would. That's just what's out there on the CDC. If we look at our vaccination rate, which is also on the mass.gov website, you know, we actually have pretty good immunization in high school, less so in middle school, even lower in younger adults, and very good vaccination rates in our older adults. If you look at the total population, it's 68% are fully vaccinated. If you just look at those who could actually get a vaccination, which is those greater than 12 years old, the vaccination rate in town is 80%, which is quite high. So one issue, and then I'm gonna, I think, stop here, or one question is about a mask mandate. And so one way to approach this is to say, at this point, we do not need a mask mandate, given the low rates of activity, the high rates of vaccination, in terms of, in general. A sort of step up from that would be to say, for board, committee, and commission meetings, maybe we should mandate masks or social distancing, because of the fact that these boards or committees and commissions are in rooms, unless they're on Zoom, where they're sitting there for a couple hours, 2 or 3 hours, with the public that may be unmasked. A sort of one notch up would be doing what 100 cities and towns are doing, which is mandate masks for all town staff and visitors. And then lastly, for all public spaces. And so I'm going to stop here, and I'd be interested in comments from the board. My own sort of thinking about this is, as of today, given where the pandemic is in terms of low rates, and again, listening to Christine, 9 adult cases in the entire town of 27,000 people, way seems, not particularly necessary in sort of my opinion. But I'd like to hear from each board member what their thinking is around, mask mandate, and also if any of the select board members have comments. I'm going to stop share so I can actually see the whole screen, and we'll go back to it. So comments, thoughts, Paula.
Just wanted to thank you for that well-organized and sane presentation. And I would agree with you.
Carrie?
Yeah, thank you, Rick. Thanks for pulling all that information together. I have a few questions that I want to start with. First, if I can go back to the data points, what do we know what the what percentage of response we had on those data points? So we have 90% for public safety and 80% for staff. Are those based on 100% participation? Or is that?
Actually, I do have that.
Great.
Because this survey was sort of redone just in the last couple of days. And in terms of the general employees, 90% of the employees responded, and 91% were vaccinated. And that's in terms of town hall, and then, or city employees in general. And then public safety, they had again, it was like 93% were vaccinated, and roughly about 90% had responded to the survey. But that's a good point.
Great. That's helpful to know. Thank you. I'm very suspicious of numbers that get thrown out without what the you know how that goes.
Oh, absolutely.
Yeah.
That's a great point, Carrie. Great point.
So that's helpful to know, and thank you. And then what was I? Oh, and then so personally, I really hate the word mandate. It makes my back go up. It makes me very cranky, and I would like to hear us talking about a requirement. I think that mandate just makes a lot of people crazy. So I'm going to say that. I'll say too, public health is about prevention. And I think that we need to be thinking forward. So while the backward data is helpful, we need to be considering what's coming ahead to us. And what I see this coming ahead is we're entering the fall and winter season. We're entering the heating season where people's windows are closed, where people are spending more time indoors and together. And we have seen that cases tend to go up. We don't know that it will mimic that, but that's what we have seen. We also know that we're anticipating a difficult flu season for both adults and for pediatric patients. And RSV is apparently wandering around and wreaking havoc now and just causing continual problems. So those things, you know, I think about that. I took a look at the BioBot as well, because that's a great indicator. That's a leading indicator. And BioBot, for those who aren't familiar, that's the MWRA project where they're checking, they're looking at presence of SARS-CoV-19 in the sewage treatment as it comes through. And what they had found was that that was a great leading indicator, is kind of 10 days ahead generally. And if there was activity, it was a and I talked to a friend who said, you know, BioBot's noisy. I said, yeah, it is noisy. There's a lot, but BioBot is up. So there was a huge spike in the summer. And then it dropped down to flat. And that was great when we were all in those salad days of feeling fabulous, like Ann said, just doing whatever we wanted to do. BioBot has gone back up and it has not actually gone back down. It's showing an uptick. So that's another thing that I'm considering. I think too, what we, one of the researchers at the U School of Public Health did a little bit. The contagiousness of Delta is such that even if you're vaccinated, you are 2 times more likely right now to be getting infected. So that gives pause. The 15-minute rule of thumb seems to also not be as applicable with Delta. It's just, it doesn't need a lot of time with you to infect. Thankfully, it's we have such a high vaccination rate that, you know, hopefully people, if they get sick, are not getting too sick, but it's still an increased likelihood. And I think the last thing I'd say is that you know, the medical system is not in a great place right now. All of the hospitals are I think region 1 out in the western part of the state is currently the only region that is not feeling pressure in terms of bed availability. Emergency departments are jammed to the gills, are boarding patients. There are organizations that are kind of doing daily checks on whether they can continue to do elective procedures because they don't have bed capacity for the patients. Now, that's not all COVID. What's happening is there are a lot of people who they're seeing is a lot of sick people, a lot of very sick people. People are requiring longer stays. People are sicker. People are presenting further advanced in their illnesses. So my point being, and ambulatory care practices are also slammed. And I mean, there are some, I have been told there are some places that are suggesting that maybe you ought to go, don't go to the ED if you don't feel well, go to an urgent care site. You know, I mean, there are some troubling trends. So in thinking about what the availability of access to medical care is another thing that I take into consideration when I think about masks. So if I looked at the numbers right now, I say, yeah, you know, that's, you know, those look fabulous. But I don't think that that is the time to back down. And I would not want to see us wait until something was emergent, because again, public health is about prevention. That's our job. Our job is to be anticipating the things and doing things to help the health and the well-being of the entire population. And doing an NPI, a non-pharmaceutical intervention such as masking, is not really a heavy burden, particularly when we're talking about in town hall. You're saying many transactions are less than 15 minutes. That's not a lot of time. If I'm weighing the health of people and I'm wanting to make sure that municipal staff are well protected and that our people continue to be well, I'm leaning on the side of at least strongly encouraging people to wear masks.
Other Paula?
Yeah, thank you for that information, Carrie, and it's really helpful. But I would still shy away from requiring at this point, but certainly strongly encouraging wearing masks in indoors in public places. I mean, I do. I go to the grocery store, whatever, I wear a mask. Because I get there. I was at a funeral the other day, a wake, and the place was packed. I had a mask on.
Yeah. Thanks for saying that, Paul. I mean, I think I closed with saying, I'd want to at least strongly encourage. I'm not sure that now is the time to require, but I'm not content with sort of letting it roll. I like the idea of strongly encouraging and making the posting a sign and letting folks know that we strongly encourage this for the health and well-being of all. So thanks for pointing that out so I could clarify myself.
Kevin, yes.
Yeah, I'm in agreement with all three of you. Certainly things can change, and they can change rapidly, as we've seen since the beginning of this. It's very great, really excellent news, especially that 80% of eligible. That's really good. Great to see it at the high school level as well too. I mean, that said, obviously we know there's going to be breakthrough cases. The incident reported earlier, the percentage seems higher than most communities, but where we only have, as you said, nine adults in town, in a town of 28,000 residents total, that's really a low percentage point. So I certainly don't see that there's any requirement right now. The tricky thing with requirements is always enforcement, right? So that's the thing that you always, if we look at things from a straight health standpoint, couldn't agree more. If you want to make sure no one ever gets sick again, we could certainly do that. It's not really reasonable from a society standpoint, though. You can't keep people from getting sick. Well, I should say you can. You're really not going to like how you do it. So, I think you have to look at it from that standpoint. Getting sick is, in certain instances, whether it be COVID or flu or strep or whatever it might be, these are things we've been dealing with for centuries now. So I don't think a zero-sum game, I think I've said this many times in the past, is the goal to say, okay, now we can really loosen up restrictions. It's just not going to ever be the case. You're never going to have zero, or for a long period of time. Maybe for a day would be great. But so that would be my feelings on it. I think just what we've done before, you monitor it if it warrants it, and it looks like it's going to move the needle more specifically in the well-being of the overall health of residents in the town. Then I think you definitely can, should discuss it. But if it's not going to move the needle, then I really don't see the point in doing so. I think there's actually there's still a part of me in the back of my head. I think I've told you the story before where, we had the masks on for so long. I don't think I was sick for about 15 months, not even the common cold, nothing. To the point when I did get the common cold, I had it for like 3 weeks. I couldn't kick that thing out of my system. So, having the immune system running is actually a really good thing. And unfortunately, there's only one way to get your immune system running, and it's to give it cause, right? So I'm not saying we should all run out and get COVID, but you do have to weigh both sides of the health issue. It's not just simply preventative. It's also making sure that your body can handle viruses and things of that nature when it comes up by having a healthy immune system. So that would be my feelings on it. Monitor it, see where it goes. If it looks like it's going, through the roof, percentages wise, numbers wise, then certainly discuss it again.
Jerry, do you have thoughts on this?
Yeah, no, I agree with not having a requirement at this time, but strongly recommending. I was actually wondering if there was some positive reinforcement we could provide. I mean, partly why we have these low rates is our high vaccination, and probably because people are wearing masks. So is there a way to turn that into like encouragement?
Very good. Very good.
Great idea.
That's a job for Jane Wellman and her messaging. Her messaging brilliance.
It may also make people feel better, Jerry. Right to your point. Yes. About the decision.
Yeah, they can see the fruits of their efforts to
exactly.
Yeah, because those numbers look great. I'm better than I really could have expected, and I have to say, good on all our municipal employees. Have a 90% return rate on a survey. That's amazing.
Yes, that's amazing.
That is fantastic.
Yes,
unheard of.
That's great. We got some of the best employees around.
We do.
And Carlo and Christy, any thoughts about any of this? Just you're here. Go ahead, Ann.
Thanks very much, Rick. I was wondering, I thought the first slide that you showed, I think it was the first one, showed the CDC recommendations for when to mask. And I thought based on our numbers, it had indicated, although it was like the lowest level, I thought our numbers from your chart indicated that the CDC would recommend some kind of masking requirement.
Yes.
Yep.
Right. But what you have to remember is that, the CDC has to publish guidelines for the entire country. I think that, at least in my personal opinion, although there could be others, I'm sure, I think that we're trying to weigh into this, our high vaccination rates are low. I mean, we are higher. We're now at 15.7. So we're higher than 10. That's right. But really on the low end of 50 for sure. So you're right. I mean, if we were going to all go by the CDC, we should be recommending masking. But I think we have to take into, what the situation is here on the ground. And so anyway, that's how I would respond to that.
Well, I think also if you pull out students, that number drops well below 10.
Yeah.
Oh, yeah, it would. Yeah.
And we want to recommend, just not require, right? I mean, we strongly recommend.
I strongly recommend, absolutely.
I am hearing from family and friends who are teachers that it's much more difficult this school year to enforce the masking requirements in school. I think because a lot of the messaging has become confused around when it's important to mask. So I think probably any clarity in messaging that you can provide would be helpful for the public.
So, in terms of, I mean, I wear masks when I go into the supermarket, whenever I go in an indoor public place, I'm still wearing my mask, and I've had my Pfizer booster as of yesterday, and my shoulder is so sore. But regardless, how would the best way to do that messaging? Would it be having Jane, draft something saying, gee, we have high vaccination rates, we're doing well in this area, but we have to, I mean, the points about going into the winter and the holiday season are very valid. We don't know what's going to happen. There could very well be another surge. And so strongly advising masks in indoor places without requiring them or mandating seems very reasonable. So I could see one thing could be putting something up on the website. Another thing could be doing a reverse 911 and getting a message out. And another could be posting something, just like, posting, having a flyer that we ask businesses to post that the Board of Health, strongly recommends, masks in indoor places. I mean, we could do that. We did that last year when obviously we were mandating it. So,
Except for we don't have an agent anymore.
I don't know.
I was thinking, the one thing that occurred to me, and I think maybe there is an adequate, not that the staff we have are inadequate, but that we don't have adequate in terms of numbers staff to pull something like this off. But just thinking about the police departments, like get caught like wearing your helmet and having some kind of reward for that, like get caught masking, like something like that. I don't know. So when you're talking about positive incentives, I don't know if there's anything in that space that would be possible.
That's interesting.
Yep.
But we could do the messaging on the electronic boards downtown too.
No, that's true. I mean, we had a year ago, last summer, we had messaging boards and we had posters and we had stuff on the website. I mean, there was a very big push on that. Maybe, as you say, Carrie, maybe we ought to circle back to Jane and find out what she would think about the best way to communicate this, where we would strongly recommend masks in indoor spaces. And I think that's perfectly legitimate. And it almost, I don't know, in my mind, wearing masks in town hall, given, a population of 27,000, how many people go into town hall every week? It's probably in the 100 or 2, maybe. It's a small number. It's not going to, restricting that isn't going to necessarily impact the broad public at large. So I think where we are is, and maybe Schwan, maybe you have some comments in terms of, I know you work with Jane, but before we go, Kevin, you have a comment.
Yeah, just real quick in this regard, if you wanted to, you could always take a vote to post signage that the Board of Health strongly recommends wearing masks right now. That will give the opportunity for people to post that in all the town buildings.
In town buildings or in all buildings?
I guess you could say in general indoors, yeah. If you so wanted to.
Yeah.
Jean's wants to weigh in on this.
Yeah.
Oh no, I just wanted to clarify. There's a enormous sign on the front door of the Pleasant Street Center that is exactly what you're talking about, strongly encouraging wearing masks and safety. And the staff, if somebody comes in without the mask, the staff very nicely and professionally makes sure that the person puts a mask on.
Good.
So that's already been happening at the Pleasant Street Center. That was one place that we were very concerned, and Kevin Bowmiller and Peter and I have been, trying to figure out the best way. The library adopted a mask policy because, of course, the library board of trustees regulates that building. So that has already been enacted at the library. Town hall, I will tell you, our foot traffic is a fraction of what it was pre-pandemic. And I will tell you that we used to have lines of contractors every morning lining up, and we have gone fully digital, fully automated. We get practically no one Although Shuang and I were there last night or the night before, and a woman came in asking about ducks. So then it was like 5:30, but other than that, and Shuang handled it beautifully. She and I looked at each other.
She did.
Like, you can do this. And Shuang solved it beautifully. And I don't even know how she did it, but she did it. She did a great job. Woman was thrilled. And, we all like kind of sighed. But yeah, it's way down. Foot traffic is way down.
The time for a duck call.
Because we've just
9 o'clock,
I
8:30.
know the word pivot has been overused, but we have pivoted, and we were going in that direction before the pandemic. And we just did it once the pandemic was in full swing. Not that it's sort of the sequence of how things went from a IT point of view. It was the worst time to do it, but we did it anyway, and it's worked out great. So that was a really big and really concerning issue of having contractors lined up, and how are we going to manage that? So that's gone away.
Remember.
Yeah, Rick, I only said that more in the light of messaging. Right? So, I mean, you really don't have to. You can just, the consensus of the board seems to all be the same. So you do either way. You can just simply leave it up as a messaging standpoint, because you're not actually, you don't need a vote because you're not actually doing anything now that I think about it. Yeah.
So actually, I think what I'm taking away from this is that we are encouraged by our high vaccination rates. We would strongly advise individuals to wear masks in indoor public places in terms of a preventative approach, and out of concern of the coming holidays and winter season. And that, we need to, and I can follow up, or Peter can, and Jean and Shuang can follow up with Jane to think about ways to get that message out, whether it's reverse 911, social media, but that's what I'm taking away. Sounds like we had a good discussion. I'm thinking, given the time, we might defer the vaccine discussion, because that's, unless people had strong feelings, because that's probably even less of an issue given our high vaccination rates. And virtually no city in town is mandating, vaccines, at least right now. So I'm going to move on to Shuang's. Shuang, did you have some comments? I'm looking.
Yeah, I prepared like 2 slides that, Jen Wellman and I had a brief meeting yesterday, and we talk about, the public information officers, what, the other towns and, nearby cities, what they are doing. And I also have, what Reading have for our COVID-19 information website. I'm just gonna share my screen. Okay. Can you see my screen?
Yes.
Yes.
Yep.
Thank you. So basically, and Jean Wellman, she asked around the other cities, including Medford, Arlington, Needham, Amherst, Somerville, Newton, Wakefield, Cambridge, and Framingham. She asked many cities and towns and get back from those towns. And some of their website contains COVID-19 data, vaccine data, or vaccine clinics, mask requirements based on different cities and towns. And they also have something like social media, robocalls, Zooms, and emails. And Jen, she also would like to mention that, you know, most of the towns and cities have a specific public information officer and a very well founded program for, you know, website posting.
Yeah.
And Jean also suggests to, you know, ask around our nearby town within region 3B. So we had a, you know, coalition meeting this afternoon. So I just asked around, and some of them, you know, have COVID data like updates, and some not. North Reading mentioned that they have, you know, updates the COVID data, and they also have some in the different age groups. And so what Reading currently have on the COVID-19 page information are the town of Reading COVID-19 data, which is the case counts. That's on the dashboard page, as well as the state data dashboard. And we also have vaccine, COVID vaccine information. It includes the vaccination data. That's the link to the state websites, and also the boosters information and the areas, the locations that you can find to get the COVID vaccine, as well as the COVID-19 homebound vaccination program. We also have, you know, state mask requirements and some guidance with, you know, social distancing. And for other resources, we have mental health resource, and we also have the CDC COVID-19 information with different languages. So that's pretty much what we have on our, you know, the yellow button, the COVID-19 information website. And yeah, I was initially wondering, like, but like Dr. Lopez said, we discussed, you know, his post a couple of months ago, and we were decided to, you know, not posting it regularly, but as needed. So I think we just, you know, have the conversation on that and made this. So, and Christine also always send me, you know, her up-to-date data, get from Maven with the cases, and she also, you know, send me like how many cases from the school. So I think that's what we currently have now. Yeah, I'm wondering if you have any comments on that.
That's great. You know, I think coming from this meeting, I think what we're saying is, you said to, you know, biweekly data posting, and also maybe in the next couple of weeks, working with Jane, we can come up with a public relations campaign or a public information campaign around masking. Any other comments for Shuang? No? Thank you, sir.
Thank you, Shuang.
Thank you.
Yeah, just that it's great. Really good. Thanks.
MAPC update. So we have engaged MAPC, Metropolitan Area Planning Council or Commission Council. And we have a signed contract. They are interviewing a wide range of individuals. And the purpose of this consulting episode is to really look at the department, the health department, and try to understand, you know, the strengths, the weaknesses, how we compare to similar communities, and make a set of recommendations of what we can do to strengthen the department in its work in public health. And so I know that they have interviewed Peter and Carrie and Jean, and I might ask those three to just comment on how those interviews went. I guess, Jean, you can start.
Yeah, I can start. I actually did check in with Mark Fine to figure out a little bit more of kind of where we're at. But I had a really good interview. We covered a lot of ground, and I thought it was really, really very helpful. And I understand that they're pretty much through all of the interviews. I think they have one more to do. And then a lot of the other data points that we had outlined in the scope, they've dug into that pretty well. And their subject matter expert, Pat Maloney, has been involved in reviewing. So it looks like the peer community data is almost fully compiled. They're still pulling a little bit of the last bits of that. And it looks like a draft may be available on some of these findings if the board is interested. And I was going to suggest that if a subset or if a representative from the board wants to get on a call later this month, I'd be happy to coordinate with that maybe towards the end of October. If it all aligns, maybe then it gets queued up for the November meeting if that's something there's interest.
Well, Carrie has been representing the board on this effort, so I think she would be the person to have that conversation with Mark. How did your interview go, Carrie?
It was good. I really, it was a thoughtful process. I thought it was well done. Yeah, I was very happy. I think I said a couple times, I'm so happy that we're finally here because we all worked so hard to get to this place. It's so hard for such a long time that to have this, actually happening was really, that alone was very gratifying. I was able to share some of the feedback that I got thanks to Peter and Jean kind of scrambling and helping me get in touch with folks to make sure that I was being inclusive, or some other good word, and made sure I was sharing other people's perspective as well. And yeah, I thought they did a really good session, and they landed the plane right on time, which I always think is a beautiful thing. Yeah, it was good. It was questions from Pat, largely from Mapc, but questions from Pat as well, kind of clarifying questions. And I think he's a great add to that team. So I'm glad that worked out.
Great. Peter, they talked to you as well.
Yeah, and the only part I found uncomfortable was when they wanted to know about records that, before I got here, do they exist? Daniel at the time was able to scurry and get the last 2 years of records really quickly. And it's amazing what the town did with the, with the computer setup we have. I think it's called OpenGov. And that was easy, but then we have, I'm not certain, but to me, I envision drawers of file cabinets that you pull out, and there's all paper stuck in there. And we would need to finger through a lot of data to find out, what we did. They kind of pressed a little bit on, did you make the number of inspections? I really couldn't answer the question there. I said we could find the answers. We would need some administrative staff to help us go through it. But I preferred that we work on, moving into the future. I don't know, what would that accomplish going back beyond the 2 years that we've been doing swell, and find out that, the paper system doesn't work that well, and we already know that. So come on. Anyway, it was a fast 50 minutes. Kerry said they landed the plane on time. I didn't think of it that way, but yeah, in a way I am now. And it went by quickly. I'm looking forward to a good report. I thought they were very thoughtful, and I like Pat Maloney. He had a lot to offer too.
Great. All right. I'm going to move along to the health director recruitment update. Jean, I think you're doing that.
Sure. Thank you. So we have had a couple of postings of the job. The initial posting went up in May, and we got 5 applicants back then. And we interviewed, and we had 2 finalists, and we were not successful in getting those finalists hired. They, for a variety of reasons, did not ultimately choose to take the job, even though we made offers. So we reposted in August. We got 4 more candidates, although we were realizing that some of the candidates that seemed good didn't have the master's degree that we were looking for. So then we went back and we modified the language, and we posted it for a 3rd time in September. And we used a little bit softer language around the master's degree. And I think it was something like master's degree or relevant experience or other credentials. And so we softened that up a bit to see if we could maybe either include those candidates that we thought were good or maybe attract some new ones. So then we ended up in total with 5 more in September. So that was a total of 14 resumes that we got. The screening committee met, and Rick is part of that committee, and agreed to interview 6 candidates on October 13th. So we whittled the list down to 6 that we would want to bring in for interviews. 1 of the candidates has withdrawn. 3 are scheduled for the 13th. 1 is traveling, and we may do a phone interview. And 1 I think we're waiting to hear back from. So that's where we're at. And I think that's pretty good.
Yeah.
Kevin.
And the candidates that we selected, the 6, and now will be 4 or 5, they all look like they have good experience in public health and doing this work. And so, we'll have to see. We were really disappointed after those first 2 candidates declined, as the position was offered to both of them. All right. So, moving right along. Incident command update. There was a incident command meeting on August 30th. No way do they compare with the minutes that Jackie does in terms of clarity and
That's right.
readability and comprehensiveness. I think the meeting was primarily informational. There was some discussion around the pandemic activity in the town and what was going on with the flu clinics that Schwang has been organizing. The new school superintendent talked about plans for the school that were underway at the time, and you could read about them. And then there was a brief discussion around Greg starting to look at developing an after action report and getting feedback from people on that and that was about it. I don't know, Jean and Peter, whether there was anything. It didn't seem like there was a whole lot of action taken. It was really more just exchanging information as I saw it.
I felt it was introductory more than anything, and seeing the new superintendent in schools was important, so you know who the players are a bit. And I was impressed with Tom. He's a good guy and wants to work with us. That's important.
Yeah. Kevin.
Rick, when's the next meeting, or when was the last one? Because that was dated what, August 30th? Was there one in September?
There wasn't one in September, no.
Okay, so is there like a schedule? You know, if we're going to do it as needed? Because the only reason I raise the question is, as I'm reading through this, it's well over a month ago, and the information almost that shared then is different now, right? So it's not relevant in real time. So I would say if there's going to be command meetings, and obviously I'm sure you would do this, but I just want to point it out. If there's relevant information going on at the time, and we're going to be meeting soon thereafter, to not wait for the minutes, but to just bring your own perspective of it to the board.
Sure. I got a sense that the meetings were going to be as needed, and there wasn't a regular schedule.
Okay, makes sense.
Yeah.
Have they started to talk about a look back?
Yes,
okay.
That's the after action plan. I think Greg Burns pulled something down from the website, and Bob encouraged him to, begin to think about populating that. Well, memories are fresh about the experience of the command, what happened, what went right, what.
Sure, yeah. The good, the bad, the indifferent is always important.
Yeah.
Because I feel like sometimes it's good to look back at it after the fact. I don't know that that's going to be the case, and it's been, like you said, it's been going on so long now that you may forget it. So might have to keep looking back at it ever so often.
Right.
All right, good. That's all I have. Thanks.
Okay, Kevin, updates on the coalition?
So I don't have updates per se. This is their last coalition meeting, is their annual meeting. It's more of an awards meeting. So I didn't attend it. There really wasn't anything crossover relative to the Board of Health for me to attend. Like I said, it's their annual meeting. But I think you wanted to bring up what you shared it with me as a moment that Erica shared it with me as well too. The new posting for the job position is finally. Is it out, or is they just sending us a draft of it?
No,
I only glanced through the
Right. So
okay.
we had. So I would say two things. One is, and I'm really bad at names, but they did hire a replacement for the coordinator position.
Oh yes, thank you.
I saw it on Facebook or whatever, and she looks very, very well qualified. Experience in domestic violence counseling, and so that position has been filled. The job description that got sent around to the Board of Health members is still in draft form. And what I was told was that this into the job description, and we don't necessarily have to do it now, but in the next 2 or 3, 4 days, if people have comments, to get them back to Bob about the job description. He's going to take that to the select board, I think at the October 26th meeting, for final approval. And the way I understood it, it wouldn't get posted till after that. Yes.
Does anybody have a sense of what, and maybe this is not an appropriate question to ask, but I wondered how much this person was going to get paid, because I thought there was some pretty high expectations in that job description.
I believe that's already budgeted.
80,000.
Okay.
Public sector. I just wanted to, I'm sure everybody just saw it, but thank you, Anne, for posting in the chat. Crystal Melanokos Gary is the outreach coordinator.
Okay. And just as a final update too, I did get this from Erica today. I'm just looking at it now. They're presenting to the school committee with the youth risk behavior survey on October 14th. So if we wanted to, we could put, she's happy to come to our next meeting and present it to us as well.
Great. Okay.
So I can coordinate that if it looks like we don't have a jam-packed agenda, or probably some good information to put on there, even if we do.
Yeah.
Sure.
That would be great.
That would be good. I'd love to hear it.
Please.
All right, I will tell her to reach out to Jean and to get on the agenda for November. Do that right now, actually.
Jean, what in terms of this job description, for the coalition, is getting feedback to Bob the right thing, or should we give feedback to Kevin, to give to Erica? Who is actually kind of drafting this? I know this has been a work of a committee, but
Yeah, I would say to get it to Bob. I think he was the one that distributed it.
yes, you did.
Just to follow that sequence, I think is probably the best bet.
Okay. I mean, I looked at it, looked pretty good to me. There are a couple items that I could add, but nothing dramatic. But I'd ask, since they are bringing it October 26th, I think, sometime in the next few days, by Monday, getting those comments to Bob so they can be reviewed and incorporated as appropriate.
Okay.
All right.
Would it be easier? I don't know. I'm just imagining Bob's workflow. If it would be easier, I would be happy to collect them and give them to Bob in all one thing, so he doesn't have to go crazy looking in his inbox.
Okay. Why don't we do that?
Okay.
So by Monday, and you guys not gonna get me. I'll just PDF it and give it to Bob.
Okay, great. We'll give it.
Okay, I just have a quick question.
Yes.
What is the exact title of the position?
Really kind of interesting. The job description doesn't have a title on it. It says coalition clinician.
Yeah, coalition clinician.
Coalition clinician, yeah.
Okay.
And one of the requirements is to either to be a licensed independent social worker, LICSW, or a licensed mental health counselor. Those are the minimum qualifications. So it is a clinical role.
No, thank you for clarification, because Ann mentioned, and for the salary portion with town meeting decided to do was for quote unquote amend. We're talking about the same thing, but as far as in my liaison report, I just want to get it right and say what everyone else is saying and not something different and throw people off.
Yeah. Coalition clinician.
Thank you.
Yeah. Peter, do you want to give a abbreviated monthly report?
Yep, can do a couple things. I goofed around earlier when someone was talking about ducks. But 2 complaints that we had just this week. One was on a rooster, and it took us a long time to locate where that rooster was, and of course, then move to show the folks that they don't have a permit. Roosters are not allowed in Reading because they disrupt sleep and they just make noise. Another one was the amount of chickens that were mailed to a family who wanted to do backyard, birds, egg layers, and they got mailed 9 instead of the 6 that they ordered. So something happened, but it turned into a little bit of a hullabaloo, and I didn't think they needed to come before the Board of Health and ask for a variance for 3 little chickies, especially when she said she's going to try to rehome them. And, we had better things going on tonight. So I just wrote that off, made notes of it so that when the permit comes up next year, we can look into it. So that was, you can call it on the lighter side if you want, but it sort of is. Other complaints we had since the last time we met, were 2 housing complaints and 1 food service complaint. I don't have details on those. Daniel did 16 food establishments, and Dennis did 11 food services there. 1 body art by Daniel, 2 housing inspections by Daniel. Dennis did 1 plan review and 2 site visits. And that's the bulk of what's going on with the street environmental health piece. This one Schwang can pick up on, because I thought this was interesting. people came to us and wanted to know where they should dispose of their mercury thermometers, and apparently we don't have a plan in place for that. Well, we should. And usually it's the solid waste contractor that services the town that is required by law to have some kind of a depot where people can dispose of mercury thermometers. We want them out of the waste stream for obvious reasons, toxicity of mercury. So was brought to my attention. I'm giving it off to Schwung, and you can talk to your colleagues, excuse me, throughout your network and find out what they're doing. Maybe someone in DPW has a really quick answer for you, and that should go up on the website. What do we do with mercury? That's been a mainstream public health program for many years, and I'd like to see Reading get up to speed on that one. You know, I spoke a lot earlier tonight about the workforce and everything. So I think that's the abbreviated monthly report. You know, I guess I'm going to end up with saying that the nursing team that we have servicing the town, despite everything else I said about staffing, we have a crackerjack nursing team in town. They do a really great job of surveillance and contact tracing and getting words out. Schwung is big into community outreach and public health education. So I think that's something we should lean heavily on, especially during these times. That's the most important program we have as far as I'm concerned, is trying to keep the infection rate down. And you do that by providing good solid surveillance and intervening when we can. So that's the monthly report for now. If you have any questions, I'll be happy to try to, put them together for you.
Paula?
Is there an update on that apartment building downtown?
Bob got from our building commissioner something on that, but my hours have been cut back to the point where I'm not reading everything anymore.
It sounds like Gene has some.
Gene does.
I've been very involved. This is the 625 Main Street.
Yep.
Apartment building, 39 units. Households were displaced back in July due to the flood that basically wiped out their electrical service. Mostly partners at the state, as well as a nonprofit, Metro Boston Housing. And with everybody working together, we were able to rehouse about half of the population. And that's to the credit of Metro Boston Housing, who had the resources and who really has the expertise in that level of detail of housing. We do a lot with housing, but not that level of detail. So the other half are, I think, intending to go back into the units. We've been working closely with the property owner, and they're showing their sincere due diligence to solve this and get people back. The fundraising that the community has done has been really remarkable, in my opinion. Lots of folks are doing lots of things, and obviously the town cannot use taxpayers' money to help the people that are in need, which is, I get it, but it just was a really tough situation for people who were really in a bind. And so having all of the people that contributed and the community partners who led the fundraising, because we can't do fundraising as a town. That's not the lawyers get very nervous about that. So so we stay away from that, but we can partner with the people that can do it and try and make sure that resources are being directed. It wasn't a lot of money, but it was money, and combined with what Metro Boston could offer for some of the resources they had, and then the relocation part, I think was key. Long story short, we're also every day I say to the building commissioner, how we doing? Anything going? Have they filed for the permit? What's going on? So we get regular updates from our building commissioner on where they're at. And so we reviewed the plans. They filed for the permit, and thankfully, the construction piece of it isn't as complicated as we thought it was going to be. So that's kind of the good news. But we still worry a lot about supply chain and availability and, you know, all the things that everyone's worried about when it comes to construction. But hopefully they can get in there and get this solved and get the folks back. The latest we're hearing is that it's probably closer to November that the building is going to be ready for them to move back in.
Okay, thank you.
Yes, Carl.
Thank you. A quick question. Gene, you might know this. I think Bob mentioned it in one of our meetings that half of the residents aren't coming back. Is that still what you're hearing?
Yeah, about half of them have been rehoused, so they've found other places or made other arrangements. So yeah, about half are not coming back. It could be more. Some people could be still looking, but yeah, some people got temporary apartments, which, you know, that's good. I don't even know how you do that, but they figured out how to get a temporary sublet. I don't know. I'm going back to college days with subletting, so I'm so out of the loop on how all that works and how much of that we have in Reading. But they found it.
All right, thanks.
Yes, Sean.
I also have you know, flu vaccine clinic updates and the emergency preparedness coalition updates. I'm not sure if I can have 2 more minutes.
You can have 2 more minutes.
Okay, thank you. Okay, can you see my screen?
Yes.
Yep.
Okay. Oh, I'll be quick. So yes, flu vaccine clinic updates. So this week, we finally received our full shipment with, you know, 560 doses. It was, you know, delayed about 2 weeks, but we received it on time. And our school clinic is tomorrow at Anwood School, elementary school, you know, for school staffs. And the following the clinic police department. And today, early this morning, half of the our firefighters and paramedics had, you know, vaccinated, and their second flu clinic is will be on the 19th. And we will also have a public senior clinic on October 26th at the senior center. The advertisement has been posted online, and we also we had, you know, residents already registered in. I also, you know, reached out to CVS and heard they have, you know, they provide opportunities to have flu clinics in the community. So I reached out to our Reading Housing Authority, Tanner Vale, also called Frank Tanner. The manager is very interested in, you know, match resource with CVS. So I get them connected, and we'll follow up with, you know, how the clinic goes. And next is the, you know, Emergency Preparedness Coalition. It's generally within Region 3B. So DPH, you know, provides the web EOC training on a regular basis. The web EOC is a emergency alert system that, you know, sending the message from the state to a local health department. And we had a testing drill around noontime this Monday. Reading has completed successfully and on time. And within the region, the passing rate is 75%. So it's quite successful. And about our planner, which are, you know, BME strategies, they are working on preparing the after action report conference scheduled for, you know, next February. And they are developing questions for the report to each town so we can share with our partnerships who help us, respond during the COVID. And as you may know, Massachusetts Health Officer Association will have an annual conference scheduled on October 20 and 21st at 12 months. I will attend it, and I've already registered. It's kind of after the pandemic, they have the in-person conference. We'll talk about the emergency preparedness and some environment steps. And last, the HMCC, which is Health and the Medical Coordinating Coalition, had a Q1 stakeholder meeting on September 29th, last week, and we had some members to present what they did, what they learned from COVID-19. They are from the hospitals, like long-term care facilities, managers of EMT. So they're just sharing their what they learned and what they had facing challenges, and like how they respond during the COVID. And if you have any questions.
I just want to make a comment that the partnership with CVS to work with Reading Housing that was coordinated by Schwang is really a first for, I think, us here in Reading as a public-private partnership. And we're going to see how that all plays out, but it could create a model for what we do next year around flu vaccination, for other segments in the community. We'll just have to see.
Rick, I got one more thing, and I won't take 2 minutes. Schwung said she was going to take 2 and took 4. I'm saying I'm taking less than 1. I probably can do it. We got a second quarter bill from mosquito control. It was a very challenging year for mosquito control, and I hate to leave this off of Board of Health agendas ever. Mosquito-borne diseases are out there, and they emerge at different times. But West Nile virus was in our region this year. We did not have, and certainly there was no Eastern equine encephalitis, and that's real good news. And I'll end on this note. It was brought up, Gene brought it up and stole my thunder, but I think it's worth mentioning very quickly about our animal control program that is now in place, and we share with another community. We have 2 family members that have been doing this for a long time. I've known them for years, and they agreed finally to work with us. Bob has struck a deal with the town manager of help me out. Wakefield, yeah, thanks. And those guys are on top of things. The 2 what seemed like frivolous animal control cases that came up earlier, they go to them. We've had a number of dog bites this summer that they followed up on, and various things. It's really a wild, it's kind of a crazy end of the business that you can joke about, but nonetheless, there's diseases that pass from animals onto people, and we need to keep an eye on that too. So I'm proud that we were able to get that in place here as well. So that's all I got now. That's for sure.
Okay, thank you. The minutes for our last meeting, October 19th, went out in the pre-board packet. Are there any edits or suggestions or changes for those?
I didn't see anything.
Okay, so I'd like to make a motion to approve the minutes from August 19th.
A second?
Okay, Carrie?
Yes.
Paula?
Yes.
And Rick, yes. Carrie, you had mentioned at the top of the meeting you wanted to make some comments.
Just thanks.
Sure.
Yeah, thank you. Just briefly, I learned LinkedIn. Social media is a fascinating thing, and LinkedIn is a great tool. And I was on LinkedIn, and I learned about a month ago that one of our members was honored at a event because it turns out they had been providing service at a alternate care site for COVID patients during the course of the pandemic. Unbeknownst to me, I don't know if anybody else knew and I just missed it, but I wanted to take a minute and say thank you to Jerry from us. And I just thought thank you for doing that. You're so quiet. You're so, quiet about it. And it was great to see that your company recognized what you were doing and wanted to join them, and congratulate you and thank you.
Thanks, Jerry. Nice job.
And that's great. That's great. I also wanted to make a comment, which this is actually Peter's last.
Yes, it is.
Yeah. And so Peter is off to Florida in November. And
3 weeks.
And I wanted to, I think when he took this position, I don't think he knew what he was in for.
Did we leave permanent interim off the position title, Peter? I think we meant to say permanent interim. Oh, sorry.
I never use interim so frequently in my life. I know what it means now.
Obviously, we've got more than our money's worth from Peter. He's done such a great job in a very difficult time. We've seen better communication, better, I think our meetings are better. We've had good information. He's really managed a lot of tricky situations, personnel situations, as well as situations in the community, really well that speaks to his 30 years of experience in public health. And he's been a great team builder in the department. And, doing it always in a really humble, warm, empathetic way. A little bit verbose, but but still very pleasant and nice. And so, on behalf of the board, I'd like to thank you, Peter. If we were meeting in person, we probably, had something to eat, do something like that, but we can't do that on Zoom. And so thank you.
But it couldn't have happened without everybody right here. So it's been a real pleasure. I hope the opportunity arises again. I would go for it. Reading is a wonderful town. I've been saying that. This board is the greatest, and we got some real good leadership in town hall. I wish I got to know the community a little better, but maybe next time. Thanks. Thanks for the opportunity to help.
Thank you so much, Peter.
Thank you, Peter.
Thank you, Peter. Reports, staff, presentations, it's all been beautiful. It's been a pleasure.
Thanks. Maybe we could become pen pals or something.
Yeah.
You're going to be tuning into these meetings. You can live stream them, I think. You'll be watching.
I'm going to be watching town meeting. I want to see Nancy Doctor go at it again. She's fun.
You're going to miss us. You're going to miss us. And you're going to be back. You're going to be, yep.
See how it goes.
Seriously, it has been, coming out of retirement in the middle of a pandemic to support us.
Yeah.
Unbelievable.
Really amazing. And we're grateful and we're better for it.
We may call on you in May when you come back. Who knows?
I'll be back. I'll be back the end of April.
The
end of April. Well, good luck through the winter, and I will be thinking of you. Thanks for the accolades. Just acknowledging, me being here to help, and I do. I really consider it a privilege. Thanks for letting me help.
Good job.
Thank you, Peter.
Thank you very much.
Hello, that's nice.
Right,
okay.
So,
motion to adjourn. I'm getting
yes. So any other comments? Otherwise, I'll make a motion to
Chris.
Chris,
over
wait.
here.
Okay.
You're on mute. Okay, here we go.
Yes, thank you, Richard. And thank you, Peter. I wasn't here obviously in the beginning to see everything that you guys navigated us through, not just you, the entire Board of Health. So I appreciate everything that you guys have done. You got it through us before, you'll get us through whatever comes next. And if you just follow the numbers that you guys went with today, I know we have other peer communities around us and whatnot, but it just, our vaccination numbers were so high. I'm glad that you take those things into account when you're looking at all the data that Dr. Lopez had put up on the graphic. It's pretty good to see that we're headed in the right direction. Hopefully it stays that way, but I mean, who knows what's coming next. But thank you, Peter, and I appreciate all you guys' help. It's you know, it's a thankless job sometimes, but you all have to do it.
Really.
So thank you all.
Thank you.
All right. Motion to adjourn. Do I have a second?
Second,
Second. Roll call. Paula,
Yes.
Carrie,
yes.
Rick, yes.
Do I have a motion to adjourn for the select board?
Second,
Chris,
Yes.
Carlo,
yes.
and yes.
It was a pleasure having you with us.
No,
Nice
that
to
was-
be
And us
here.
again.
Thanks for hosting us.
Honor.
See you around town, everybody.
See ya.
Bye-bye.
Bye.